Hey everyone, welcome to my channel. I am Kendra Perry and I am a certified functional diagnostic nutritionist. So in the next 3 videos, I'm calling it the A to Z SIBO series. I'm basically going to take you through step by step the entire process when it comes to identifying SIBO, testing SIBO, treating for SIBO, and then preventing reoccurrence of SIBO. So I get questions like this all the time. So I want to take you through A to Z step by step in the next 3 videos. So in this video, in video number 1, I'm actually going to go through what SIBO is, what causes SIBO, and what the best way to test for SIBO is. Okay, so what is SIBO? So SIBO stands for small intestinal bacterial overgrowth. And it's basically a condition where bacteria that is totally normal in your large intestine actually migrates up into the small intestine where it doesn't belong, and it causes a ton of dysbiosis and issues. So the small intestine compared to the large intestine is actually meant to be relatively sterile. So there's actually not meant to be a lot of bacteria in the small intestine, and that's because it's the site of digestion and absorption. So when you don't have a lot of bacteria in the small intestine, bacteria gets digested, it gets absorbed, it gets assimilated, and there's no issues. But when there's a lot of overgrowth of this bacteria in the small intestine, basically you're feeding the bacteria and not yourself, and it's causing a lot of malabsorption and dysbiosis and gas production. So typically when people have SIBO, they do experience a lot of gas and bloating. They may experience a lot of constipation, maybe chronic diarrhea, maybe a lot of belching. Or they may have none of those symptoms at all, and they may just experience a lot of recurrent miscarriage or even skin infections and acne. So it can kind of depend on the person to what experience they actually have. Okay, so what actually causes SIBO? And before I get into that, I actually want to just discuss what are the 3 different types of SIBO. So SIBO is not just one thing. There are different types of SIBO. There is hydrogen, there is methane, and hydrogen sulfide dominant SIBO. So typically with hydrogen sulfide, and that just refers to the type of gas that the bacteria is predominantly producing. There's hydrogen SIBO, typically the person has chronic diarrhea, whereas with methane, they have chronic constipation. Hydrogen sulfide SIBO is a type of SIBO we don't know much about. There's not currently a way to test for it, but it tends to cause that really nasty rotten egg smelling gas or even a sensitivity to high sulfur foods. Okay, so what actually causes SIBO? Okay, so there's a few different things that cause it, but typically there could be parasites. Okay, so parasites, so maybe there was a time in your life where you got gastroenteritis or you got food poisoning, and getting that parasite actually totally paralyzes the nerve endings in the intestine. And this is going to in turn paralyze the migrating motor complex, or the MMC, which is actually the motion that's responsible for pushing all that bacteria down that's not supposed to be migrating up the GI tract. So it may be that you got a parasite while you were traveling or even while you were at home, and that actually led to nerve damage, which led to the desensitization of the migrating motor complex, which then led to the bacteria to move into the small intestine. Eating too frequently can cause this, because you actually need a break between eating for the migrating motor complex to occur. So if you're eating all the time, if you're grazing all day, this can actually be a reason why someone might develop SIBO. Physical adhesions is the next one. So physical adhesions refers to any sort of buildup of tissue or any sort of adhesion or blockage that might happen in the small intestine. So a blockage could lead to a valve being open that's not supposed to be open. So for example, the ileocecal valve, which connects the small to the large intestine. If that gets plugged open because of some adhesion or some physical issue, then a lot of that bacteria is just going to be able to travel up, because that valve that's normally closed and blocking the bacteria out is now wide open. Okay, so there's a variety of different causes, and I think in a lot of cases it's a combination of everything. Okay, so SIBO, I mean, it's a popular thing, right? Everyone is talking about SIBO. It's kind of trendy these days, but it's actually not the first place that I think you should start when working with your clients. Okay, so you might have remembered that I mentioned that parasites is actually one of the #1 causes of SIBO. And for this reason, you actually need to address the parasite infection first, if there is one. Otherwise, the SIBO is just going to come back. So when I work with someone who has chronic GI issues or chronic fatigue issues, and I'm interested in knowing on what is going on in their gut, I do not start typically with a SIBO test. I will start with a GI stool test. So something that assesses the large intestine. Currently, I use the GI map or the 401H. But basically, we want to address if there's any parasites present, because if they are present, we actually want to address those first. So SIBO is not always the first place to start, even if you are just so convinced that you have it, or you're so convinced that your client or patients have it. Always start with a GI stool test, something like the GI map, and identify or rule out any parasite infections before moving to the bacterial overgrowth. So when it comes to testing for SIBO, you absolutely need a 3-hour lactulose breath test. This is the gold standard, and the reason we want this test is because 3 hours is typically the time that it's going to take for the food to travel, or the sugar solution that you drink when taking the test, to travel from the small intestine to the large intestine, or sorry, from the mouth into the large intestine, okay? And we want to identify what type of SIBO is actually present. And the reason is because that will determine the protocol. And the protocols are very different. So it is very important to know what type of SIBO you have. And I get asked this question all the time, like, is it actually important? Aren't the protocols similar enough? No, they're not similar. They rely on different types of treatment. And we do want to know what type of SIBO we have, okay? And when it comes to testing for SIBO, whether you're a client wanting to get tested or you are a practitioner wanting to test, you do need to get training in this. It's not just a yes, no. You don't just get the test back and it's like, yes, you have SIBO, no, you don't. There's actually some interpretation involved. So if you're a patient, don't try to do this yourself. And if you're a practitioner, make sure you get trained up. Otherwise, you're not going to know what you're looking at, okay? So when it comes to SIBO testing, typically you want to see hydrogen gases below 15 in the first 120 minutes. And with the methane, you want to see them below 3. But a lot of SIBO tests are actually going to say below 12. And I would say that's the conventional range. But if you have a methane between 3 and 12, and you have a patient or a client or yourself with lots of GI issues, lots of constipation, then you are going to want to treat that as methane. So I always treat methane above the level of 3 as methane dominant SIBO. And in some cases, there's actually both. So you can have both, and then you're going to have to do 2 different types of protocols. And you're probably wondering, what about hydrogen sulfide SIBO? Because if you remember, I did mention there is a third type of SIBO, but unfortunately, there's currently no way to test for this. I know there's some stuff going on for research in this, but it's currently not in the market, so you currently can't get tested for this type of SIBO. Signs that you may have this type of SIBO would be that you tested negative for the other types of SIBO, you got nothing going on a GI stool test, and you're kind of at a loss, and you're having a lot of digestive issues, and maybe you're having a lot of sulfur smelling gas, so that rotten egg type of stinky gas. Maybe you have sulfur smelling breath, maybe you have ammonia smelling sweat, and maybe you react to those high sulfur foods like cruciferous vegetables and eggs. So that might be a sign that you have this type of SIBO, but the bad news is there isn't currently a lot known about it. But if you think you have this type of SIBO and you've done all these other things, or you have a patient who you think might have this type of SIBO, definitely talk to me. I can help guide you through the protocol that you'd want to do for the hydrogen sulfide SIBO. But in this video series, we're going to focus on hydrogen and methane because we can test for that, and that's where we have the most knowledge about. So I hope you enjoyed video 1. In video 2, I'm actually going to talk about the different treatment methods for SIBO. I'm going to take you through how to know when you should use what type of SIBO treatment, how to retest for SIBO, and we're also going to be talking about diet. Should you actually employ a FODMAPs diet during SIBO treatment? So that's coming up in video 2 of the A to Z SIBO series. See you guys then.